Hello, my name is Hussam, and this video is to spread awareness about COVID 19 and what are the everyday precautions that you must take to avoid this virus. The first precaution is to wash your hand often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, sneezing, or spending time in public. If soap and water not available, you can use hand sanitizer in the condition that it contains at least 60% alcohol. And if possible, try avoid touching high touch surfaces in public places. For example, elevator buttons, door handles, handrails. Try avoid touching them, and if you do touch them, make sure to wash your hand or use hand sanitizer. And for example, if there is no water, no hand sanitizer, and you touch something and you can't wash your hand, try avoid touching your face. Don't touch your nose, your eyes. Avoid touching your face. The second precaution is to avoid close contact. If someone inside your home becomes sick, they should be tested for COVID 19. If they tested positive, they should be isolated from the other household members to keep them safe. And when you are outside your home, stay at least 6 feet away from people who don't live in your household. And make sure to wear a mask. And remember, some people don't display symptoms of COVID 19 and may be able to spread the virus. The third precaution is to cover your nose and mouth when around others. Everyone should wear a mask or other face covering in public, especially when social distancing measures are difficult to maintain. Masks should completely cover both nose and mouth, and remember that you could spread COVID 19 to others even if you don't feel sick and there is no symptoms on you. The mask is meant to also protect other people in case if you are infected. And continue to maintain 6 feet between you and others even while you're wearing a mask. The mask is not a substitute for social distancing. The last precaution I want to talk about is simply to clean and disinfect frequently touched surfaces. For example, your cell phone, your keyboards, your light switches. Try to clean them frequently and disinfect them. Because let's have this scenario. If you went outside and, for example, you touch an elevator button and you go back using your phone, you will maybe sanitize your hand and you will wash it to clean it, but then you will go back to touch your phone, but you didn't clean your phone and disinfect it. So this is why disinfecting surfaces that you frequently use is important for you and will minimize the risk for you to getting this virus. And that's all for the precautions of COVID 19. I hope everyone be safe and make sure to follow them for you to minimize the risk of you getting this virus. I hope you stay safe and thank you.
So, hi, I'll be talking about the benefits of vaccination and symptoms of COVID-19. So, COVID-19 vaccination benefits, as you can see here, protect you from getting COVID-19, that's general, prevent you from becoming serious ill, becoming hospitalized or dying due to COVID, limit the spread of COVID-19. So, vaccination, it is one of the most effective ways to protect our families, communities and ourselves against COVID-19. Evidence indicate that vaccines used is very effective in preventing severe illness, being hospitalized and death from COVID-19. Primary series of mRNA vaccines, for example, Pfizer, which is well known in Malaysia, plus a booster shot. Booster is the third dose we should take. So in Malaysia and in worldwide, it offers a better protection against Omicron infection and severe disease than the primary series alone. Among people, a study shows that people vaccinated, their level of protection against infection from the primary series decreases over time and is low against Omicron. But it can be improved with a booster shot. The primary series appears to maintain good protection against severe disease and it prevents from being hospitalized and death. Protection against being vaccinated, it's always give protection against severe disease is higher after a booster dose. So booster dose is really recommended. Like everyone should take a booster dose because it helps a lot from getting COVID-19. So vaccination is a very important, even if you are being previously infected by COVID-19, while infection alone provides some protection. Vaccination after infection helps improve the immune response and may provide better and longer lasting protection. For protection against COVID-19, it is important to receive a primary series as well as a booster dose if you are eligible for it. So it's important to return for our second dose. After the first dose, it is important to return our second dose. So it's recommended as an 8-week interval between your first and the second dose. So people are 18 years of age and over are eligible for booster dose. Our government recommends that this booster dose can be given at least 6 months after completion of the primary series, which is the first dose, and after first dose 8 weeks we need to get the second dose, and in the 6 months, at least in the 6 months, we should get the booster dose. Receiving all these recommended doses provides very good protection against severe illness, also not being hospitalized and not death from COVID-19. It gives some good protection against getting infected and becoming sick. So next, I'll be talking about the sign and symptoms of COVID-19. So COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. So most common symptoms is fever, cough, tiredness, loss of taste and or loss of smell. The less common symptom is sore throat, headache, body pains, diarrhea, a rash on our body like on the skin, and red or irritated eyes. So the next I'll be telling about the serious symptoms. Serious symptoms are difficulty to breathing or shortness of breath, loss of speech or mobility, and another one is angina. Angina is chest pain. So if we have these kind of symptoms, we need to seek immediate medical attention and always call before visiting doctor or health faculty. People with mild symptoms who are otherwise healthy should manage their symptoms at home, like being isolated from other people, stay in the room or quarantine quarantine in the room for like 5 days. So on average, it takes 5 to 6 days when someone is infected with the virus for symptoms to show. However, it keeps takes up to 14 days. So as we mentioned here, signs and symptoms include respiratory systems and include fever, cough, and shortness of breath. In more severe case, infection can cause phenomenal severe acute respiratory syndrome and sometimes death. So we can even find all this information at My Sejahtera, which is a Malaysian developed app where it provides all the COVID-19 information. Other than that, if we are tested positive with the RTK with the self-test kit, we can we should take a picture of it and we should update ourselves in the My Sejahtera so that they will ask us to do home isolation for at least 5 to 7 days so that we will not spread the COVID-19. So that's all from me. Thank you.